Okay, we're going to talk about thrush. And if you ever had kids or babies, infants can get thrush. Thrush is an overgrowth in your mouth of a yeast. Hey, how you doing?
Good. I was going to say, look at her in the nice shorts.
Thrush, okay. It's an overgrowth of a germ called Candida. Not Canada, but Candida. And that germ grows in your mouth after surgery or in babies because there's a change in the environment. And the normal bacteria which live in there get overwhelmed by the yeast germ. Now, why does it happen? When you starve, you may remember from diets you've been on in the past, you get ketotic. Okay, you may remember even getting little sticks to measure your urine to make sure that you were ketotic. And as a reminder, as a refresher, when you burn fat, the fat molecule, as it gets metabolized, goes down to a molecule called ketone bodies. So you're burning fat, and it releases these waste products called ketones. Ketones, as a chemical name, should remind you of another pretty powerful chemical called acetone. And acetone is nail polish remover. Imagine that in your bloodstream is an increase in nail polish remover. That chemical, in small amounts, begins to leak out into your mouth. So that gives you that horrible, icky taste. You just can't clear it almost. It's so unpleasant. And there's no way to clear it because that's being released through the bloodstream into your mouth. When that chemical goes into your mouth, the normal bacteria that live there get killed off. Unfortunately, the yeast germ called Candida can live in that environment. And so it grows as an overgrowth, and it can also cause irritation and pain, and that's when we have to go ahead and use that treatment of the nystatin. Over time, it will get better on its own. There's no way to get it better too fast because the ketone bodies are killing off all the other regular bacteria. So in one way, you can look at it, it's a positive because you're burning fat. Unfortunately, you've got a secondary infection because so much of the fat is being burned to ketones that it's hurt the lining of your mouth. And that's why we get it in our post-op patients, and it'll go away in the next several days. So that's thrush.